Benefits provider touts first group health medical cannabis program for employees in some states by Ben Adlin. A new partnership between Benefits Health and Canna Coverage will give businesses a chance to offer discounts on medical cannabis as part of their workplace benefits package. The benefits reduce out of pocket costs for employees who use cannabis therapeutically. Cannabis Health, which describes itself as dedicated to filling the holes in the health insurance industry for medical cannabis patients, announced the partnership with Canna Coverage, an insurance broker that works in the cannabis industry. In a press release, Cannabis Health says that it's the first group health medical cannabis program. Cannabis is not a traditional health insurance plan. They provide additional benefits that can be integrated into existing health plans, kind of like Aflac. For people who don't have benefits through an employer, Cannabis has individual membership that qualifies patients for their discount at participating dispensaries. Cannabis has two membership plans, basic and premium. The basic membership is $29 per year and offers medical cannabis education. According to the website, the education is created by a team of healthcare experts, including a former US Surgeon General. The premium membership at $120 per year offers 15% discount at participating dispensaries in New Jersey, New Mexico, and DC. The website claims that the members save an average of $100 per month on their medical cannabis purchases. So, doing the math, that equates to monthly purchases over $600. This partnership is an early example of a coming trend that normalizes medical cannabis coverage in the workplace. A press release reads, with the recent recommendations of HHS to reschedule cannabis, these two organizations anticipate legalization in the near future. Schedule 3 will normalize cannabis as medicine, and the future of healthcare would include this new benefit option. Canna Coverage founder and CEO Nichelle Santos says the opportunity for cannabis to be rescheduled allows a pathway for medical cannabis as a multimodal option and alternative to opioid and other synthetic prescription drugs. Our goal is to expand into all states that offer medical cannabis, said Cynthia Tantum, head of marketing. We are interested in talking with any medical cannabis dispensary interested in joining the network. Co-founder and COO Jeff Booker said that their offering is not only the moral thing to do, but there's also an economic impact. A tremendous cost savings will be realized in reduction of medical cannabis claims and prescription benefits that impact the bottom line. Cannabis Health does not cover hospital costs nor vision or dental. It just covers cannabis. A member needs to buy at least $60 of cannabis per month to break even. Essentially, it's a discount buyers club like GoodRx, which generates revenue from subscription fees, referral fees, coupon redemption, and advertising. Like rescheduling to Schedule 3, this effort seems more symbolic. Would you sign up for Cannabis Health? This is Dr. Jean Talleyrand for High at 9 News.
Oh man, Dr. T, this is great news, I feel like.
Are you going to offer it at your dispensary?
I
You can
mean,
join their network.
I mean, it depends on how much their network is to join, but I mean, it is something that I think that that is definitely worth a consideration of. Learn more
Yeah,
about. Yeah.
15% doesn't seem enough to me, but
Yeah, I
anyway.
was gonna say, I worry that this is really optics and PR newswires over substantial public policy change. We're not talking about a healthcare network or system that offers conventional access to other types of medical modalities. And so the fact that it's just sort of this little thing kind of makes me feel like it's a Costco membership. Like if I spend enough, I get a free hot dog at the fucking exit. The other thing that worries me is that healthcare has never found a way not to increase the cost, the complication, and the logistics of treatments and really patient directed out, patient focused outcomes. So like, let me get this straight. I got to spend money to make money. It's a subscription model. It's this, it's that. I feel like it's just a really recycled business model we've seen a lot in regulated cannabis that has been clothed in a healthcare bathrobe. Do I think that cannabis should be covered under healthcare as a way of increasing access and lowering costs? Yes, but I don't hear that in this article yet.
I agree. I feel it's very symbolic more than anything. But it may be the direction to go if a bunch of people want to reduce their costs for cannabis they're purchasing, or want to ensure that the products they're purchasing are medically oriented, or medically beneficial. Then this might be a good way for patients to get together and form
When the
their own
VA
membership plan.
when the VA becomes the biggest purchaser of pharmaceutical grade cannabis in America and flexes its significant purchasing power, only then will I breathe a sigh of relief.
Do you think they'll be purchasing direct from farmers, Yarrow?
No, they'll probably start an exploratory committee to
Uh-huh.
study the most complicated way to create a third-party purchasing entity and then stand it up with a friend of theirs who went to high school with them. And then the first 2 years will be about stakeholder input and coming up with models that don't work. And eventually, after they fuck it up, they'll probably say, "Well, we learned a lot." And then who knows? Maybe it'll be like that regulator that was assigned in that state we covered last week, who was in and out in 48 hours. No, I think that they will probably find a way to shoot themselves in the foot. But I do think that to me is the litmus test for whether healthcare has acknowledged cannabis as medicine is when the VA system offers it at no or low cost to its considerable constituents, and where we don't have to rely entirely upon the noble work of these compassion programs and all the veteran focused groups that are really trying to make sure that there's less barrier to entry when it comes to the resources it takes to access this medicine.
Mm-hmm. Fair enough. You have any thoughts on this, Gretchen? Hearing?
Sorry.
Oh,
Couldn't find my mute.
okay.
I would say I think it's a good move. I mean, it may not be the greatest, but everything's a first step.
Yeah.
And so we need to be taking these wins as we get them.
I'm with that. I feel the exact same way on this. Even if it's not the best plan, I mean, it's a good start. It's someone out there trying to do it and
It's in the right direction.
Yeah, trudging that trough. I do worry though a little bit, Dr. Talleyrand, if this picks up too much steam and then it just ultimately becomes the standardized rate because it was so successful in its initial launch. That is one thing that I do worry about in something like that. In regards to the points that you brought up, Yarrow, but nonetheless, we're going to keep this train moving.